Sometimes the most honest conversations about health don't happen in a doctor's office. They happen in the barber's chair. That's the idea behind our new series, Shop Talk, where we shine a light on the health issues men face and how to tackle them head on this Movember. Now, Live 5's Justin Kolar stopped by Oscar's Family Barbershop. That's the oldest barbershop in Charleston, to sit down with the local cardiologist who says just one small step could make a big difference.
We are here at Oscar's Family Barbershop, the oldest barbershop in Charleston, and we are joined today by Dr. John Fry. He's a cardiologist with HCA Healthcare Trident Hospital to talk about men's health. And we're going to put this plainly, here at the barbershop, I feel oftentimes, sir, that men will open up a lot more in the barbershop chair than perhaps they will at the doctor's office. First of all, why do you think that is, and what's a simple way that men can kind of continue that conversation beyond this one and take a step forward in their health this month?
Well, there's a misperception among a lot of us men that admitting to health problems, particularly heart, something as serious as heart, is a sign of weakness. When we're around some of our peers, it's a little easier to discuss things, but when you're around others in society and in public, it may not be as comfortable talking about your issues or other health problems that you might have.
Also, bringing it back to the barbershop here, I think there's, you feel so much better after you get a clean shave, you get the lineup, you feel like you're ready to tackle the world. What's an easy way for men to kind of take their health, their heart health, into their own hands?
Well, first of all, getting your heart checked. We have a phrase, say, know your numbers, either with your primary care doctor or a heart specialist. You want to know what your blood pressure is, what your blood sugar is, and your weight. Beyond that, the two most important things are you have to move your body, so exercise or regular activity, and walking can be just as good as anything. In diet, we recommend something like a Mediterranean-style diet. There's also a diet called the DASH diet, which is promoted by the American Heart Association.
So very good to start walking, to kind of take that next first step, if you will,
right,
and to walk into a better, a better month, a better life, to take that health into your own hands. We talked about some of those examples here. What are maybe some symptoms or some things that men might be living with that they should maybe not ignore, but what are maybe some telltale signs that things are starting to go awry in their health?
Right. One could be that when you start walking, you can't walk like you thought you would be able to, or you start developing some breathing difficulties, chest tightness. The classic symptoms for heart problems are sort of pressure in your chest, or feel like a quote-unquote elephant is sitting on my chest. A rapid breathing with exercise. We also recommend that you have a primary physician that can see you on a regular basis.
It's kind of like having a barber, someone who knows your hair. You don't just walk in someplace and want the cut. They don't really know, how you get it, how your hair feels, all that sort of thing. Is there anything that we didn't ask you, anything that you would like to add when it comes to this in men taking their health more seriously, not only this month, but using this kind of as a jumping off point for men to kind of walk into that next chapter of their life more healthy than the previous?
Right. Well, we should all recognize that heart disease still is the #1 killer for both men and women. And so it's not something to ignore. Taking the first step is very important to living a nice, long, healthy life.
Dr. Fry, we want to thank you again so much for taking the time. It's great to meet you, sir. And we want to thank Oscar's Family Barbershop as well for having this beautiful backdrop here that we could use to kind of paint that picture for you guys. Get that haircut. Leave the beard, though, this month. We need to grow the beards out for Movember and take your health seriously. For Live 5 News and Men's Heart Health Month, I'm Justin Kolar.